My name is Alexander. I'm the head of the dental department of company Saremco. We are based in Switzerland. We are a company which is specialized in composites, adhesives, and etch and shale, so for restorative dentistry. And our company is a lot involved in research and development, and we have a very good contact with many European universities. And today it is my pleasure to present you our company, and especially also a lot of very interesting and relevant studies which have been carried out in different European universities over the last years, and which are very relevant to your daily work also. Slide number 2, please. So first I would like to give you a short overview about Saremco itself. Saremco is a company which was founded in 1987, so this year we will celebrate our 25th anniversary. Saremco is today represented by in about 40 countries, and in Iraq our representative, our exclusive representative is Al-Miftat company, Mr. Kais Al-Assaf, which is also in the audience today. Thank you very much for having organized this event together with the university. So just a brief history about Saremco. We started with in 1980. At one point, actually, the etching process will be completed. On this slide, you see on the left side the animal which is a little bit shiny. After you see on the next, on 10 seconds, you see that small bubbles are being built, and at 30 seconds around, you see the big bubbles. Now, this is the chemical process. It's actually the air inside the animal or dentine which is liberated, which creates this bubble. But by this special technique with the Saremco microseed etch and shale, this effect is actually visible. You must know that every animal has a different etching time. Some animal is a little bit harder than others. Animal, and even in the same patient, one tooth to the other, it needs a different etching time. In the microseed etch and shale, you can actually visually observe at which point the etching process is completed. When you see the big bubbles, you can rinse, the etching is completed. You don't need to watch the time. Next slide, please. On this slide, you can see the etching process. After a few seconds, you see small bubbles are building. This test has been carried out at the University of Zurich in Switzerland to see this effect in process. You see that small bubbles are being built, so the etching process is starting. Next slide, please. On slide number 9, you see the etching process. When it is completed, you see the big bubbles, and that means etching process is complete. You can rinse, and after it, go to the next step. Here you see very well this visual effect, the visual control. And this is quite unique for the microseed etch and shale from Saremco. Next slide, please, number 10. Now, this is a photo from the University of Zurich. You see here an enlargement of 500 times of the etched animal surface after 30 seconds. You see here a very nice mechanical retention, so the etching process was very efficient with the Saremco etch and shale. A rough surface has been created. Very smooth micro-retentions have been created, which will allow in the next steps for very good adhesion Slide number 11, please. Now I would like to move to a very complex but extremely interesting subject, which is the composites. There is a lot of things which are already known and a lot of things which still need to be tested in the future, but I have here the pleasure to show you today a few of very, very interesting studies which have been carried out about composites and which have actually an influence of daily work for you as a practitioner, as a dentist. Sarenko, we have two composites. One is ELS, extra-low shrinkage, and the other Sarenko microhybrid composite. Both are high-quality composites for posterior and anterior restorations. Then, of course, we have also a flow version of the composites. The flow I would actually recommend to use also, for example, at the bottom of a cavity, because it will allow you, when you use, for example, ELS flow, when you have a deep cavity, the flow will go very easily inside the corners of the cavity, so you can avoid to have air inclusions in the cavity, and therefore you can avoid problems in the future. Another advantage, if you use ELS flow as a first layer in the cavity, is that the flow composite, because it has less mineral fillers inside and more resin, it is slightly more soft than the normal composite. So actually the physical properties of the flow are closer to the dentine. So when you have a cavity which goes to the dentine and you use as a first layer the ELS flow, you have a product which has properties which is closer to the dentine and which has a certain elasticity with the flow. Now this can also reduce post-operative sensitivities, because if you would use straight away the normal composite, which is of course not the technique, but then during the mastication of the patient, there is the risk, of course, that the forces from mastication will be transferred directly to the pulp and lead to sensitivities. When you use a flow first, you have the advantage that the flow will act as like from a car, like a shock absorber. So the forces from mastication can be slightly absorbed from the flow, and therefore it can help to reduce sensitivities later on. Okay, now I will do next slide, please, number 12. On slide number 12, I would like to explain you what exactly are the main problems today with composite resins in general. The problem of composite resins is that you have a curing shrinkage. A composite is a chemical product. It is mainly composed of a mix of a resin matrix and a glass filler. Now, during the curing, the molecules, they will go closer together, and therefore a shrinkage will take place. Later in my presentation, I can explain you what exactly the consequences of the shrinkage are and what type of shrinkages we have, because there are different types of shrinkage. I will talk about this in a few minutes. So, curing shrinkage will lead to a problem about hermeticity in the filling, and also it can lead to a problem in the adhesion of your restoration. Then another current problem about composite resins is degradation in service. I will have a few interesting pictures about this also. You must understand that when you have placed your filling and light cured it, it is in a humid environment, and therefore there will be things going on. There will be erosion, there can be leakage of certain molecules, which I will explain also. So a lot of things can happen. Just because you have light cured the composite does not mean that now everything is okay, nothing will happen. There will be, on a very small level, there will be things going on which are not really visible on the first view. So, degradation in service means there will be abrasion, there can be dissolution, and fatigue. Fatigue means the material will show a fatigue, and therefore can lead to a problem about adhesion. The next problem about composite resins is the bonding to hard tissues. As you may know, in the beginning of the era of composites, it was only possible to adhere the composite to enamel, but the adhesion to dentine came only very later on, many years later, because adhesion to dentine is particularly tricky issue. Chemically speaking. Next slide, please. Some information about polymerization. Polymerization is the conversion of monomers into polymers, and that can create a volumetric shrinkage of the composite resin. Because actually the molecules, they will go closer together. The consequences you see below in this slide, there is development of stresses at the interface between dental tissue and composite resin. That can be a consequence. This can lead to an opening at the margins, and you see this opening. This can be a few microns, but this can be enough that bacteria can infiltrate this space and create secondary caries. You see on this picture on the left side here, the opening of the margins due to the shrinkage stress of the composite. So the stress inside the composite, I will explain that later on, how the stress is building up. This stress actually can lead to the fact that the composite does not stick anymore very tightly to the dental cavity. And therefore this can lead to bacterial infiltration and a recurrence of caries. Slide number 14, please. Here you see the shrinkage of polymeric filling materials. The origin of shrinkage is due, as you see on the upper picture, to the fact that when the resin is not cured, the molecules, they keep a certain distance to each other. And as soon as you polymerize with the curing light, there will be actually the monomers which are getting closer together, and therefore this creates a shrinkage. During the chemical process, the molecules, they go closer together, they link with each other, and this leads to a volumetric shrinkage, and in the consequence to a shrinkage stress, which I will explain in a moment. Now, how to decrease the shrinkage stress? Actually, there are two types of decreasing the shrinkage stress. The dentists today, actually, they will decrease the shrinkage stress by using a layering technique. By using a layering technique, you will actually mask the effects of the shrinkage stress, because the shrinkage stress is inside the product. Every composite develops a volumetric shrinkage, but also a shrinkage stress. And by using a layering technique, you can mask the effect of the stress, but you cannot avoid it, because the stress is inside the product. Then, the other approach to reduce the shrinkage stress is to use a material where inside the material this problem has been diminished a lot. And in the Sarenco composite, mainly ALS, we have actually reduced the shrinkage stress of the composite to improve the quality of your work for your patients, to have better fillings and longer lasting fillings of better quality. So what Sarenco has done actually, when we developed during many years the composite from Ceramco, the main goal was to decrease the shrinkage stress of the product on the one side. And this we have achieved. I will actually show you after it a study which has been published in many European countries, which proves these results. So when you as a dentist use a material which already from the manufacturer side has a reduced stress inside the product, this can avoid you a lot of problems and help you to do better restorations. Now the last option, by modifying the composite itself through the manufacturer, has the advantage that it will markedly improve the clinical behavior of the composite resin. Next slide, please. On slide number 16, I want to briefly explain the influence of the filler quality on the practical features of a composite. Nowadays, many are talking about nanocomposites and so on, but it is a fact that the quality, the abrasion, and translucency and so on of a composite, the solidity of the composite is due to the resin itself and due to the glass filler of the composite. As I said before, the composite is mainly a resin plus glass filler. In total, there are maybe more than 30 components in a composite, but it's a mix of resin and a glass filler. So, very important feature is the glass filler, and not the nanoparticles. The glass filler is what gives the composite the strength, because glass, as you know, it's very solid. So this glass has an influence on abrasion values, on the abrasion of the antagonist, on the brilliance, on transparency, and also on marginal adaptation. All of these features, which are very important, are due to the glass filler, to the quality of the glass filler. Next slide, please. For Ceramco products, use very pure and very homogeneous bioglass fillers. Ceramco composites are made of very pure glass fillers. There are no impurities at all. We have a very fine medium particle size. The particle size distribution is very narrow. That means we have small particles, but there is not much smaller and much bigger ones. So the size of these particles is extremely homogeneous. This is a sign of good quality of a composite, because it will help you to make an extremely easy polishing, and also to have a surface where no bacteria can attach, and therefore where you can have a very long-lasting restoration without discoloration of the restoration itself. So then it is important the quality of the stylization of the glass fillers, because you must understand that the glass fillers by themselves, they cannot chemically connect with the resin modules. Therefore, the glass filler must be submitted to a treatment of the surface. So this is called silanization. The silanization is a coating of the glass filler, and this will make the link between the glass particle and the resin modules. Next slide, please. On slide number 18, you see this chemical process of silanization. You have on the left side, you see the glass filler, which has an oxygen molecule, and then you see the silane, which has on one side, which can connect to an oxygen molecule, and on the other side it has a carbon molecule. Now, the carbon molecule will connect to the resin, and the oxygen molecule will connect to the glass particle. So, it's very important to have a good quality of the silanization. stabilization, and Sarenko has a very highly developed technique to have extremely good stabilization of all particles. And as we have extremely fine particles, that means stabilization process is very important to have all the small particles well cyanized, so that all of it is cyanized but without any excess. Because if you have too much cyan, then there will be the negative impact that there will be more shrinkage also. So all of these features are very important. Slide number 19, please. On this slide, you see actually the different glass fillers of different composites. Here you can see that not all composites have similar glass fillers. There is a big difference. On the composite on top, you have a conventional composite. There you see small glass particles and bigger glass particles. Now, when you have a product like this, it means when you do polishing, there is a risk that these big particles will be taken away during the polishing. There can be small micro holes in the product and on the surface where bacteria can attach. Or later there can be discoloration and so on, bacteria which can attach to the surface. Now, in the lower part, you see actually the Sarenko composite, the filler of both our composites, ALS and microhybrid. The fillers are the same. In an enlargement of 500 times. Both pictures here is made with an enlargement of 500 times. This picture was taken by the University of Basel in Switzerland. They have put both composites into an acid to dissolve the resin, and all that remains is the hard glass particles. And then they make this picture, this enlargement, to see the difference. So in the lower picture you see the particles of Sarenko composites. You see the fillers are extremely fine and extremely homogeneous. Now when you have a product like this, like Sarenko, that means the polishing will be very easy and very efficient. With the polishing you create actually a mechanical protection. But because Sarenko has done these advantages already inside the product, the very smooth surface, it will save you time in polishing, and even, as you may know, when you have a rough surface, you could polish a composite as long as you want. You will not get the same result as if you have already right from the beginning a composite which by itself has a very fine filler and therefore a very smooth surface. Next slide, please. Here you have these pictures again. In a standard composite, you can see that there can be small, bigger particles. Next, please. And on slide number 21, you have the same enlargement of the Sarenko composite fillers, both for microhybrid and for the MS. And where you see the filler is extremely fine, extremely homogeneous, and there you have all these practical advantages of easy polishing, protecting the surface against the bacteria which could otherwise attach to the surface. So a surface like this will lead to a very good quality restoration. Next slide, please. Here you have again some results which were done by the University of Zurich. It is a general research about different filling materials compared one to another. You see here actually the abrasion of MOD restorations over a period of 5 years. You see here the abrasion in microns, and the more up you have the line, the more abrasion you have. So you can see that amalgam has the highest abrasion over a period of 5 years with around 150 microns. composites got finer fillers, finer glass fillers, so abrasion values have improved. For a certain time there were also micro-fill composites. Actually they don't have any glass fillers but only silicium dioxide as a filler, so therefore they did not really establish on the market because they absorbed too much water and they became very opaque very quickly. Now you see also natural animal has an abrasion value of around 50 microns and finest hybrid composite, which means composites which have a very fine glass filler, like the ones from Ceramico I showed you before, they have abrasion values which are very similar to natural animal. And the best in dentistry is to have the goal to be as close to nature as possible. So if we have a filling with an abrasion value which is very close to natural animal, this is of course a very big advantage. It's a very good result. Just one more point about this. Sometimes when you see the technical data sheet for composites, some will tell you that their abrasion value is even lower than natural animal, or it's very low. But that is a risk because that means the restoration itself is extremely hard. There will be less abrasion made on the restoration, but it will have the effect of having a great abrasion on the antagonist. And that should be avoided. You should have something which is as close to natural animal as possible to have a natural abrasion. These results here were carried out at the University of Zurich by Professor Kleici and Professor Lutz. Professor Kleici now is actually working as the head of the dental department at the University of Geneva. Next slide, please, 23. Here you see another study which was done in a masticator. A masticator is a machine at the university which can simulate the usage of the restoration in service. It is a machine which will simulate the mastication process. Now, after many thousands of mastications, the pictures were taken of standard composite and compared to the Ceramico composite. On this first picture, on slide 23, you see the occlusal contact area of a standard composite after this mastication simulation in the university. Here you can see that there can even be, you see in the middle on the top of the picture, you see there is a small bubble, there can be even air inclusions. At the lower part, you can see that there can be fractures, which is due to the mastication. So in general, the result here is not very appealing due to the fractures and air inclusions which have been caused due to the mastication process. Slide 24, please. Here you have a comparison with exactly the same test carried out or with microhybrid composite from Ceramico. You can see here that the occlusion contact area of microhybrid is extremely clear. There is a very clear imprint, but there is absolutely no fractures. There is absolutely no air inclusion, and the surface is extremely smooth and clear. Now this is a sign of a very good quality. So this restoration will for sure last very long. Next slide, please. Now I would like to give you some scientific information on the other composite from Ceramico, which is called ELS. ELS stands for extra long shrinkage. And ELS is the first true microhybrid composite providing extremely low polymerization shrinkage stress worldwide. Today there is no which have been published by the university. Slide 26, please. ALS is a light-cured microhybrid composite for anterior and posterior restoration. But it has a new resin matrix technology, which is a true, real innovation with real advantages, which I will show you step by step. Slide 27, please. On slide 27, I would like to explain to you the different types of shrinkage. Actually, a composite has two types of shrinkage. The one is volumetric shrinkage, and another one is shrinkage stress. On the left side of this slide, you see how to measure at the university the volumetric shrinkage. This is, of course, simplified, but it works exactly like this. To measure the volumetric shrinkage, a composite will be glued to a glass plate, transparent glass plate. Then the container which you see there will be filled with a liquid, usually mercury. After it, the composite will be light cured through the glass plate, and then the chemical process will start. The molecules will go closer together. There will be an empty space created on the composite due to the fact that the molecules go closer together. The empty space will be filled up by the liquid, and therefore on the scale which you see on the right, in the university they can measure what is the volumetric shrinkage of this specific composite. On the right side, one addition to this. Now you see here on the left side about volumetric shrinkage that this does not really reflect the reality, because your restoration is actually adhering to the dental walls. Here you have only one bonded surface, the surface with the glass plate. All the rest, there is no bonding, there is no resistance. But in the reality, you may have 2, 3, 4 bonded surfaces. Now it's very interesting to see what happens on these bonded surfaces. Is there a force applying to these bonded surfaces? And this can be measured also for all the composites. It is called shrinkage stress measurement. The process you see on the right side of the slide, you see see this small line, during light curing, the composite will shrink volume. But as you see on the second picture, already after a few seconds, the composite will actually reach so-called J point. The J point is the moment when the composite is more solid and soft. Now, as soon as this J point is achieved, the composite will start to pull on the dental walls and therefore will deform the dental cusps. Now, this is due to the shrinkage stress. The higher the shrinkage stress of your composite filling, the more there will be a deformation of the dental cusps. Now, as you know, the enamel of the tooth is actually the most rigid part, the hardest part of the human body. Therefore, it is absolutely not flexible. So, if you apply force on the enamel due to high shrinkage stress of a composite, this can lead actually to cracks on the enamel. It can actually lead to a sensitivity on the palm due to the deformation of the dental cusps, even if it is only a few microns. A few microns is enough to create cracks on the natural enamel and to create maybe sensitivities on the palm. But there is also a problem in the long term when you have high shrinkage stress that you see on the picture 3. After a certain time, the bonding is maybe not strong enough anymore and it can lead to opening of the margin due to the fatigue of the adhesive and due to the shrinkage stress. Now you see, due to the shrinkage stress, there can be after a certain time in service the opening of the margins, and that can lead to infiltration of bacteria, as you see on picture number 4. Infiltration of bacteria and therefore secondary caries comes later on, and then the restoration must be replaced. Now, it would be wonderful if you can reduce this shrinkage stress already inside the product to avoid all these problems. That's what we have done at Sarenco with the ELS, with our composites. And you see that on slide number 29, please. On this slide 29, you see that the life cycle of a restoration with the Sarenco composites. We have also in our products, the Sarenco composites, a volumetric shrinkage. But the big difference is that there is only an extremely low shrinkage stress. That means, as you see on page 2, on the picture 2, there is no deformation of the dental cusps. Therefore, the dental cusps will stay in place in their natural form because the shrinkage stress will not deform the natural form of the dental cusps. Now, this avoids you many problems. You can avoid micro cracks on the natural enamel. You can avoid an opening of the margins. You can avoid infiltration of bacteria, and therefore you can assure quality restoration which will last longer, where the patient will have less problems, and so on. Slide number 30, please. The consequences of shrinkage stress, there can be immediate consequences or consequences later on. The immediate consequences of shrinkage stress is due to the shrinkage stress. You must understand that shrinkage stress builds up over a time of 30 minutes. So that means the patient maybe you have already finished the treatment with your patient, but the patient will have pain only later due to the fact that the shrinkage stress builds over a certain time. It's not that shrinkage stress is there immediately and then it is done. It builds slowly up over a period of 30 minutes and then it stabilizes, and then the stress, this tension is stable as long as the adhesion will be efficient. But of course, if you have a product without stress, there will be no tension, it is much more natural, there will be no deformation, and therefore you can avoid all of these problems due to the stress. But later on, due to shrinkage stress, the consequences can be white lines, open margins, discoloration, and secondary caries. Slide number 31. Reducing the shrinkage stress means that we have an exact volume of filling, that you can guarantee tight margins, that there will be no tensions and no post-operative sensitivities. And also, you can reduce the risk for secondary caries as a consequence. Slide 32, please. Slide 32 was taken by the University of Zurich in Switzerland. And here, actually, you see these micro cracks which are due to the shrinkage stress of a composite. Here you have an extreme case. You see on the right side, on the right part of the tooth, it is all the composite restoration. Only the small part on the left, where you see the cracks, where you have the flash, this is the natural animal. Now, this picture was taken 30 minutes only after the restoration was done. 30 minutes before this picture was taken, there was no cracks on the natural animal. So during these 30 minutes, the composite has actually pulled on this natural animal and has deformed it. And because the natural animal is extremely rigid, it was enough to create all of these fissures on the natural animal. Now, the highest, let's say, philosophy as dentists is, in our opinion, and probably also yours, to conserve everything which is intact in the tooth. So if there is intact animal, we want to preserve it, we want to conserve it. We want to take away only what is really affected by caries, replace it, and keep all the rest natural. We don't want to destroy healthy tooth tissue. And by a high shrinkage stress, this is what can happen, because the stress here has actually damaged the natural animal. Now, I don't know how many of you are working with loupes or even microscopes. We have here in Switzerland a very important professor doing fillings only with microscopes, and he made actually a statement that when he works with a microscope, he can see the building up of these micro cracks as they happen. And he made the same statement also when he works with Sarenko composites. He can avoid these cracks. He can see by the microscope that these cracks are not building anymore, due to the fact that we have extremely low shrinkage stress in the Sarenko products. Now, a very important and very, very interesting slide is the scientific results about this, which you see on the next slide, which I want to present you for the first time in Iran. These results have never been shown in Iran before, and therefore I'm really very glad to all of you that I have this opportunity to show you all these results.
So we keep it as a secret.
Actually, this is published, so actually this can be shown to everyone. It's a very, it has been published in many different countries already.
Okay.
In very well-known dental magazines.
Okay,
The results which you have here have actually been tested by ACTA University. This is the Center for Dentistry in Amsterdam, in Holland. They have actually invented many years ago the machine how to measure shrinkage stress in composites. Today they are the founders of these measurements, so to speak, and today actually they produce these machines to measure the stress, and they sell it to different universities worldwide. So it is actually ACTA who has made this study and who has published it also in different countries. So I want to explain you what these results actually mean. Until very recently, it was not possible as a dentist to have reliable results which are really comparable about volume shrinkage of different composites and shrinkage stress. Until very recently, everybody was only talking about volume shrinkage. But as we saw before, composites have two sides of shrinkage, the volume shrinkage and the stress, the force which is building up the composite. So it is to have a good view of a product, it is important to know both results from the volume shrinkage and in addition from the stress. And in order that the study truly is comparable, it is important that it has been made by the same persons, with the same method, measured at the same time, and carried out in the same institute. If you have a study like this, then it is truly comparable and truly reliable. Because otherwise, if you want to compare different shrinkage volume measures, you have no idea was it made with the same method. It was probably made by totally different methods, which are absolutely not possible to compare. It was made by different universities, with different methods, by different persons. Then the study or results then are almost not comparable at all. Now that is why this study you have here is extremely interesting and extremely reliable, because all the products were tested by the same person, measured at the same time. You see 30-minute values in the time book, and at the same institute with the same method. Now, you see here on this graphic, which actually, if anybody wants to have this result, our partner for Iran, Al-Meshkan, Mr. Kaiser Asaf, which is in the audience, he can give you a printed version later on these results. I can send it to him or to our colleagues from the university there in Mosul. They have it already also, and they can give it to you if you want to have it. It is an official publication.
So, Doctor, this is the same result which is held in IDR in Thessaloniki.
Yeah, this was actually
the same result in post-precision.
Yeah, this was presented also in scientific meetings, exactly.
Yeah, in IDR in 2007.
Exactly, yeah.
Yeah.
So, to explain this result, in the bottom you have the volume shrinkage from 1.5% to 6%, and you see all of these results are measured up to 30 minutes. Because there, I must tell you that many results don't say anything because they don't mention at what time volume shrinkage was measured. You must know that volume shrinkage also takes. If you get results from any product and they give you a result, let's say our product has volume shrinkage of 1%. Then you as a dentist, you must be critical enough and question this result. You must say, okay, 1%, but what method has been used? And result of any measure after 1 minute, it is not the final result. It seems to be a much better result, but it is not the final result. After 1 minute, it's only a fraction of what you really have in the end as volume shrinkage. And therefore, what is very good about the results here on this study is you have the true values after 30 minutes. Now, so you have here for every product the volume shrinkage from 1.5 to 6% in the bottom, and on the left side the graphic goes up. You have the balance for every product as well about the shrinkage stress. So for each product you have the two values, and not only the volume shrinkage. You know what is the stress of the product and what is the volume shrinkage of the product, and you can very good compare these results. So you have here also this graphic, a black line. This black line is the so-called correlation line. It is the average of the products. So some products are above this line, some are below this line. You can see that this line goes actually from the right down to the left up. Can you see this? So if you have a product, for example, with a high volume shrinkage, let's take the one on the very right, Ultra-C, for example, you have about 5.5% volume shrinkage, but you have a low stress. The stress is less than 5 megapascal. But you want to have also a low volume shrinkage. So, the more you reduce the volume shrinkage, you can see that the shrinkage stress is more and more increasing. When these results were first shown to many different professors, they were all very surprised because everybody expected when you have less volume shrinkage, you will have also less stress. But actually, the opposite is the case. When you reduce the volume shrinkage, in general, you have a higher stress. If you take, for example, a product Grandio on this list, it's on the left side, on the very top, you see it has a very low volume shrinkage, less than 2% after 30 minutes, but the shrinkage stress is 20 megapascal. It's a very high stress. So you resolve one problem, you have less volume shrinkage, but you actually create another very big problem. You create much more shrinkage stress, which can deform the cavity, it can lead to open margins and sensitivity and so on. So on this graphic by ACTA, you see three products in red. These three products in red, they have a correlation which is less good, less advantageous. So it has at the same time more volume shrinkage and more stress than the average of these products here. For example, the SED 100, you have almost 24 megapascal stress and around 2.5% volume shrinkage. So it is above the average line. You have here three products in red. Then all the products in black, the majority of the products, they have more or less the same relation between volume and stress. And then you have the products below, which are in blue, which have better values than the average. And there you can actually see that ALS and ALS flow from Cerebral have the best correlation because at the same time they are among the ones with the least volume shrinkage, but they have by far the lowest shrinkage stress of all products. If you see here, the average is at about 15 megapascal of stress with ALS, where we have reduced the stress. The stress is 3 times less than the average, or almost 5 times less than the product red on the top. When you have, as we said, you will use also often a flow composite, and there you see that ALS flow has So compared to, for example, pediomolar flow or tapering flow, it has less volume shrinkage and less stress at the same time. Therefore, this is really ideal to use the ALS flow as the first layer in your cavity. Are there any, usually, we can have questions in the end if you like, but if you have a specific question now to this shrinkage stress, you can ask now if you like.
We have many questions about this subject, but later on we will discuss with this. As I told you, we want cooperation with you in the future because we have a PhD students and this subject is very important. But now we don't have the time. Okay.
Yeah,
thank you.
But we can discuss
we
can.
As I promised you.
Yeah, very nice. Okay. Please, slide 31.
Yeah, C factor.
Exactly.
Okay.
So the C factor is very important. We don't have too much time here, so I cannot explain it in the very detail. I will just give you a very short idea about the C factor. The C factor is also called the configuration factor. The C factor is nothing but the correlation between bonded surfaces to non-bonded surfaces. So the more bonded surfaces you have in the restoration to do, the higher the C factor. Now, the result of this is that if you have a lot of bonded surfaces, of course, like in the case at the very right, in class 5, there it is very rigid. So the more bonded surfaces you have, the more rigid it is, the more important it becomes that you use a composite with a low shrinkage stress value. So as soon as you have 2, 3, 4, or even 5 bonded surfaces, please check that you use a composite with a low shrinkage stress. If you have a composite with only 1 or maybe 2 bonded surfaces, then the volume shrinkage is more important. But the more bonded surfaces, the more difficult the work becomes for you, and the more important is that you have a composite with a low shrinkage stress value. And as we saw before, the ALS has very excellent values in this case and also the ALS as well. Now, please, slide 35. On slide 35, you see the graphic was made by Agda University and also presented at scientific meetings. What you see here is actually the limits which were determined by Agda. They said a true universal composite is not a
absorption and dissolution. Yeah.
Okay, very good. Now, here you have the results from the University of Geneva about water absorption of composites. As we said before, composites, they are in a humid environment, they do absorb water, and therefore something will happen. The best composite is the one which absorbs very, very little or nothing at all. Nothing at all is not possible chemically speaking, but it needs to have a very low water absorption value. Because if you have a low water absorption value, your composite will have a very good color stability over many years. If you have a higher water absorption, the composite very soon will become more hard. The aesthetic result will not be so nice. So, low water absorption is important for the aesthetic aspect and also for the toxicology aspect. Because when there is water absorption, later on there can be also leakage of critical substances during the lifetime of the composite. So on this result, if you look water absorption, 7 days, you see that ALS has a value of only 0.6%. Microhybrid composite from Cerenco 0.64, and if you take an example, for example, Vitex Supremia, there you have with the same study 1.29% of water absorption. You see there are differences in the water absorption. So with ALS and microhybrid, you can guarantee you a product with a very low water absorption and therefore a very good color stability. And also an advantage on the toxicology side because there will be also less leakage of critical substances. Next slide, please. On the next slide, this was also carried out at the Swiss Scientific Institute at EPFL. It's the École Polytechnique Fédérale de Lausanne. It is the Center for Polymers in Switzerland. They have a very, very high reputation. It's a very brilliant institute and we have been very glad to study with them. What you see here is the conversion rate of composites. Actually, when you use, as soon as you use the polymerization lamp on your composite, you will actually start the chemical process. From then the monomers will convert to polymers. But I must tell you that in general, this conversion can never be 100%. Even if you polymerize for 1 hour, it does not change anything. There is a certain chemical barrier which makes that you cannot go over a certain percentage of conversion rate. Here in the graphic you have first the results from 0 to 40 seconds. There you see that the ALS from Cerenco at first has a little bit a lower value than the other products. At the same time you see that Cerenco microhybrid composite has already the highest conversion rate from all tested products. Now, you must understand also that when you take the light away, the conversion continues. With the light impulse of your curing light, you have started a chemical process which will continue even after you take the light away. And in this graphic on the right side, you see the result from 1 hour to 169 hours. Here you can see that, for example, for microhybrid, you have about 56-57% of conversion rate after 40 seconds, but the process continues, and after 1 hour you reach 62%, and after 25 hours you are at about 66%. So this is the same for all products. You have first the conversion rate which goes very fast, and then it becomes more and more slow, but it continues for about 25 hours. And you see here in this result results that ELS from Cerebro, for example, has in the beginning a lower conversion rate, but after 1 hour it is in the very good middle with around 58% conversion rate. So you have their products which achieve only one product, the one in blue, does actually move only very little from 40 seconds to 1 hour and remains at the level of around 52% volume. The medium products are around between 55 and 60%, where you find ELS also, and microhybrid from Cerebro reaches the best level of conversion rate, which means it will be very stable. And then you have actually also the properties. When you can go to the next slide, please. On slide 39, you see the erosion of the surface. These pictures were taken by the University of Geneva. And here you see what happened on the surface of a composite. It's very interesting to see that after you polymerize, something happened. This is, of course, a level of 10 microns. You see the scale below 10 microns. You see that on the left side, you have the product dry, and on the right side, you have the product after 24 hours in water at 37 degrees. You see already an erosion which is taking place, and this is only after 24 hours in water at 37 degrees. So erosion can happen very quickly already. Here you have these two products, and now we want to compare it exactly the same study, what it gives with a Cerebro composite. Please go to the next slide. Slide number 40, you see the erosion of the surface for Cerebro products, Cerebro composites who have on top ELS. You see also an erosion taking place, but already much less than the two pictures before. And you see here microhybrid composite, which has an extremely good, stable surface. Both products here are very erosion resistant, and especially microhybrid, because it has a higher conversion rate, has a very good erosion resistance. So this is very interesting to see visually what this erosion, how this erosion can be, what it looks like. Now, slide 41, please. Toxicology. I would like briefly to say a few words about the toxicology issue. You must understand that, as we have seen, composites don't polymerize 100%. They absorb water, and therefore there is a risk that certain molecules can leak out of the restoration during the service or during the lifetime of the restoration. Now, in most composites you find a molecule, a monomer, which is called TEG-DNA. This is a very short monomer, and the problem with this monomer is that it has a certain cytotoxicity. So a certain number of patients can react to this with allergies. In the worst case, it can go through the bottom of the cavity and reach the pulp and cause necrosis of the pulp. Now, in the University of Munich at Ludwig Maximilian University, LMU, there is Europe's leading toxicology professor. It is Professor Dr. F. Israeli. He's really toxicology. He has studied the issue of toxicology, and his specialty is toxicology of dental products. He's doing a lot of basic research which never before has been carried out. And he has done also a study about leakage of co-monomers from dental filling materials. In this study, you see actually that TEG-DNA is actually leaking out of most composites. quantities of leakage. These are actually microgram per milliliter. You have here the real values. What quantity of this substance is leaking out of these products. And this actually was published by Professor Reichel at the Scientific Congress in Europe. It was published at the IAER meeting in Thessaloniki. If you have been there also,
I presented some work there, And the same. That's why I asked you about the same result.
Exactly. So this was published at this scientific meeting in Thessaloniki in 2007. So this is very interesting to see. It's the first time that these results were actually available about leakage of monomers, especially THPMA, because it is a short molecule, it can leak out and at the same time it has a toxicity level. So you see on this graphic that the cerebral composite ALS does not leak out HPMA or THPMA because the goal of manufacturing of development of ALS composite was to avoid the substance, to have for the dentists a safer product for the dentists and also, of course, the patients. Because you must understand that also the patients are in a risk of group of risk because they are exposed to these substances every day also. You must know that gloves, if a dentist is using a glove is actually a biological barrier but not a chemical barrier. So certain substances can go through the glove. But with ALS, you have a safer product because these substances are not in the product, and here on this study you have the scientific proof for it. Now I'm getting close to the end of my presentation. We would like to show you just a clinical case, a preparation of tooth number 15. Please, next slide. Here you see preparation of tooth number 15. And on slide number 43, you see the finished filling with ALS. You see here the aesthetic result of the filling done with ALS. So at this point, I have finished my presentation. I hope it was very interesting for all of you, and I hope I could show you many new and interesting scientific results. What is happening here in Europe and some of these results which were carried out over the last years. And I'm especially proud that I could present you this result for the first time in Iran together with your institute. Thank you a lot for your attention and thanks for giving me the opportunity to show you these results. It was a pleasure for me, and if you have questions now, please don't hesitate.
Thank you for your nice presentation and for nice knowledge we